This is Dr. Parsa Mohebi from Parsa Mohebi Hair Restoration. We have a special case for you. A gentleman with multiple procedures in past. He had actually 2 other strip procedures in past with 4,000 grafts transplanted. His hair long, so he doesn't care about the scar in the back, and he prefers to have a strip procedure to get more number of grafts per day to FUE. His hair is very fine, but he still have a good number of hair on the back. The density is not back despite of having 2 other procedures in past. Procedure fine-tuning procedure of previously done hair transplant procedures. There's kind of thinning in front, but that's not his priority. The priority is going to be his gutters, that his comb hair from certain angles, those sides are going to become more visible. That's the problem that he has now. Balding, which is a big area. We just going to put 1,000 grafts there. He knows with his fine hair is not going to be huge coverage. To take anything to make the crown area less visible and add more density to it. From the back, you can see the crown is a big area. We're going to cover that. Of course, it will never be exposed like that because it's always combing hair over it. If your crown become too thin, you may feel like you're doing comb over. So you need some density in that area. From previous procedure, you see scars present, obviously, and it's a little bit stretched on certain areas. So we have to remove the scar and try to do trichophytic closure to minimize the visibility of the scar. Sequential strip removal, we remove the first strip and close the area. He had a stretched scar and some subcutaneous significant scarring. They removed them and closed it with trichophytic closure. We're going to do the crown area. It's important to him. This is the primary area. That's the secondary area, the dot lines. So based on whether or not we're going to get the number of grafts that we want, I can go back and make more sites, but I want to make sure the initial priorities are covered. That he's styling his head, some visibility of the hair, skin is bothering him. So I'm going to do gutters on both sides. If we have enough sites, grafts, we're going to reinforce the hairline in front. So making sites in the crown area, I always start from the roll area, which is almost like a hairline for patients because that's the part that is more exposed. Dense packing the roll area will help the other areas because hair moves away from the center, and basically that area can cover the other neighboring areas. And then as we cover that area, we will move to the other areas, making sure we parallel to the existing hair. Procedure's over, and we could give him a little bit more than 2,800 grafts, which is pretty good for somebody who had already 4,000 grafts transplanted. Look at the picture and see what we did. So this is the top of his head. This is the area of his first priority, the crown. We put a good 1,000 grafts there. And then we did the gutters, this area that when he was combing his hair back, the skin was visible. On both sides, we put a good 1,000 grafts there too. So these areas were nicely covered. And then, since we had extra grafts, put them in the front hairline, right behind the hairline, not the hairline itself, and behind it. These are pictures of the front on 2 sides. And the mid-front, we went all the way back to here. And as you can see, everything is nice and clean before he left. We had some tight closure in the back, so we had to partially close it and come back to it. This patient was an ideal candidate for a strip procedure, although we do a lot of FUE procedures these days, but some patients just can do as well or even better with strip. The big number of grafts that we gave him, he wanted to see if he can improve the scar on the back that we tried to close it with trichophytic closure. Hopefully we can improve the scar. The biggest advantage of FUE is that there's no scar. He already had the scar, so that was not even a problem for him. That's it for today. We're going to follow up with another procedure tomorrow. This is Dr. Mohebi from Parsa Mohebi Hair Restoration. Have a great hair day.